Welcome to Approach to ABG's Part 4, Metabolic or Respiratory. We're going to discuss what does respiratory mean and what does metabolic mean when we're talking about acid-base assessment. So, how do you regulate your carbon dioxide levels? And the answer is through your breathing. And how do you regulate your bicarb levels? Essentially, not 100%, but essentially through your kidneys or other metabolic processes. So we're going to call anything that changes your carbon dioxide levels a respiratory process, and anything that changes your bicarb levels a metabolic process. So this is our equation. Hydrogen ions plus bicarb will shift over to carbon dioxide and the part that we're not writing down anymore, the water. So anything that changes your carbon dioxide, levels going up or levels going down, this is going to be a respiratory process. And if you hypoventilate, meaning you breathe less, you eliminate less carbon dioxide, we would expect your carbon dioxide levels are going to go up. Well, what kind of impact is that going to have on your acid-base status? Remember, the shifting chemistry says that if a chemical on one side of the equation goes up, it's going to shift the equation the other direction. So in this case, it's going to shift to the left. And we don't really care what's going to happen with the bicarb. We're only asking the question, what happens to the hydrogen ion concentration? And it's going to go up. So a higher hydrogen concentration means more acid. This means the pH goes down. This means we have a process called acidosis. So when you hypoventilate, you will generate a respiratory acidosis. The opposite is true when you hyperventilate. When you hyperventilate, your carbon dioxide levels are reduced. This creates a little bit of a vacuum in the chemical equation, so it's going to shift to the right. This is going to consume hydrogen ions, which is going to reduce the concentration of hydrogen ions. And so we have a lower hydrogen ion concentration. Remember, this means less acid, or in other words, more base. The pH goes up, and you have alkalosis. This is the definition of a respiratory alkalosis. What about when the bicarb levels change? So if, for whatever reason, your bicarb levels are reduced, this is going to create a little bit of a vacuum in the chemical equation on the left-hand side, so it's going to shift to the left. Remember, we don't care what's going to happen to the carbon dioxide. We only care what's going to happen to the hydrogen ions. And when it shifts to the left, they're going to go up. So when you have decreased bicarb, this gives you a higher hydrogen ion concentration, which means more acid. The pH goes down, and this is a metabolic acidosis. And you can probably predict where the next scenario is going, where your bicarb goes up. This is going to increase chemicals on the left side of the equation, so it's going to shift to the right. Again, we don't care what's happening to the carbon dioxide. We only care what's happening to the hydrogen ion concentration. It's going to get consumed when the equation does a shift to the right. So you're going to have a lower hydrogen ion concentration, which means less acid, which means the pH goes up, and you have an alkalosis. And because this primary event is starting with the bicarb, this is a metabolic alkalosis. So anything that changes the bicarb as the initial process we call metabolic acidosis or metabolic alkalosis. Anything that primarily or initially changes the carbon dioxide, these are respiratory processes. So respiratory acidosis, respiratory alkalosis. So we have 4 different scenarios. We have a metabolic acidosis, which is a low bicarb, and it creates a low pH. We have a metabolic alkalosis, which creates a high bicarb and a high pH. A respiratory acidosis that creates a high CO2 and a low pH. And a respiratory alkalosis causes a low CO2 but a high pH.